I have Benton's Road Veterinary Clinic in Mount Martha on the Mornington Peninsula. We are a team of, we have about 5 vets. We've got a team of 17 people in total on our staff. We run a conventional veterinary clinic that also offers integrative approaches to healthcare. So we do all of the usual things that most vet clinics do. We do surgery, we do dentistry, we do consultations, preventative health, vaccinations, but we also have the ability to draw on some other modalities such as nutritional counselling, some Western herbal medicine, Chinese medicine we use from time to time, acupuncture, some body work. So that encompasses probably all that we do. CBD oil we've been prescribing now for a couple of years, and we find it really useful in a number of different cases. So I think the indications that we find it most useful for are those pets that are suffering from osteoarthritis, those pets that suffer from skin allergies or skin itching, skin irritations. Inflammatory bowel conditions is another indication for that medication, and anxiety as well. And I think the place where CBD oil really has a part is when we have a pet where the conventional or the usual medication is contraindicated for some reason. So the easiest example I can think of is your dog with kidney disease or your cat with kidney disease is suffering from osteoarthritis. The conventional medication that we usually rely on is a non-steroidal anti-inflammatory, and that is contraindicated in animals with kidney disease. So we need to think outside the box, and CBD has the beautiful benefit of treating the osteoarthritic pain, but also being supportive to the kidneys and not causing further damage. So that's one of the great ways we use CBD. The other avenue that I think CBD plays a part is in combination with other conventional medications. So we often have pets that have got a number of different conditions, and they might have previously required a range of medications to try and treat all of those conditions, but CBD can improve and affect all of those conditions with the one type of medication. So you can get improvements in a dog with osteoarthritis, itching, inflammatory bowel disease and anxiety, all with one medication instead of needing to rely on several. And then the other place we use it is when a dog is already on a lot of conventional medication but needs further help. So palliative care of really senior patients, or palliative care of cancer patients where they need more pain relief. So they might already be on a non-steroidal, they might already be on gabapentin, they might already be on even some paracetamol, and we can bring in CBD carefully with those medications and careful monitoring. CBD is a really safe medication, and the only adverse side effects that I tend to see with CBD is when I've maybe gone a little higher on the dose than what an individual patient needs, and the most common side effect that we see is just a dog that's a little bit sleepy. The benefit of CBD is that it doesn't actually have an LD50, so it doesn't have a lethal dose that has been known to kill 50% of the population it was tested on. It's an incredibly safe medication, and even the studies that have chosen really high doses and really extended treatment programs have just caused sleepiness in those patients rather than toxicity. So I love the fact that it's a really safe medication and can be used in combination with other things. Got 2 cases that come immediately to mind. One of them would be Pepper, who is a cattle dog, and she's a typical cattle dog in that she's really reactive and a little bit highly strung, and we battled for a really long time trying to get her stable on medications to help her anxiety. So she tried fluoxetine and sertraline and clomipramine, just about everything. She'd been referred to veterinary behaviourists and non-veterinary behaviourists and trainers as well, and we couldn't ever get her comfortable on a medication. Either the medication had no effect, or when we stepped it up to a higher dose, it caused her to lose her personality. So she became a bit subdued, and the owner just wasn't happy with that. In the end, we decided to keep her on the standard dose of fluoxetine, which on its own was having no effect, but we brought in a low dose of CBD, and the combination of those 2 medications has got her right in her sweet spot. So she retains all of the personality traits that the owner likes, but she's less reactive with other dogs, and for me it's great because I can examine her without being bitten in the clinic, which makes me happy. And one other case that I have comes to mind is a Weimaraner called Roman, who suffers from Weimaraner immunodeficiency syndrome, which is a deficiency of IgG, and he was triggered into an autoimmune crisis by his second vaccination, sadly, and before coming to see me, had spent the last 18 months in trying to die in a number of spectacular ways, and his veterinary history was massive before he came to see me. Stunted in growth, no hair, chronically pyrexic, so really high body temperatures, white blood cells through the roof, and just erupting in inflammatory conditions and infections all over. So he's been a real battle, and I'm never going to say that CBD has cured this dog because we're never going to get him well, but we have got him to a stable plane with a combination of approaches, and one of them is CBD oil, and his body temperature is normal, he's grown his hair back, he's put on a bit of body weight, and he's less aggressive, so he's quite reactive in the clinic as well. He's much happier and really settled at home, so the owner is ecstatic. She travels 90 minutes to see me every 6 weeks to continue treating her dog, and he's a real success.